Hi there, I'm Christine, and this is the Canadian Constitution Foundation's Freedom Update. Right now, hospitals in Ontario, where I live, are overwhelmed, but it is not because of COVID. So I want to talk to you about what's happening, why it's happening, and what we are doing about it at the Canadian Constitution Foundation. If you're new here, welcome. My name is Christine, and I'm the Litigation Director for the Canadian Constitution Foundation, which is a Canadian legal charity that fights for fundamental freedoms in Canada. I upload regular videos about our ongoing work, our ongoing cases, and about other interesting developments in constitutional law in Canada. So if that sounds like something you'd be interested in, please hit like and subscribe below. It really helps my videos out a lot. And please remember that my videos are never legal advice. If you have your own legal question or problem, please consult your own lawyer. Now, one thing that the COVID-19 pandemic has revealed in really painful clarity for Canadians is the woeful inadequacy of our healthcare system. Canada's healthcare system was overwhelmed multiple times during various peaks of pandemic waves. But even now, as COVID cases and hospitalizations have been trending down, multiple Ontario hospitals are overwhelmed. The system is in dire need of an overhaul and of some innovative thinking. At the end of May, Brampton Civic Hospital announced a code gridlock. The Children's Hospital of Eastern Ontario in Ottawa said that their emergency department just had its busiest May ever and is on pace to set a record for June. That hospital went on to say that on the weekend of June 11th, they had 16 patients admitted that did not have a bed to go to, and some ended up staying in the emergency department for almost 48 hours. Now, keep in mind that those are pediatric patients. Toronto's Sick Kids and the McMaster Children's Hospital in Hamilton also have reported similar busier than average Mays. Now, this is not pandemic overwhelm. This is run-of-the-mill system failure. And overwhelmed emergency departments are just the tip of the iceberg. Ontario has a pandemic backlog of 1 million surgeries and almost 22 million healthcare services. Long wait times for surgery is a systemic issue in Canada caused by the rationing of healthcare services in a government monopoly healthcare system. It is no wonder that Canada was so easily overwhelmed by COVID. We teeter on the brink of overwhelm on a regular basis, even without COVID making the picture worse. Canada ranks near the bottom in overall hospital beds, with an OECD report showing that Canada has just one hospital bed for every 400 citizens. Even before COVID-19, 91.6% of Canadian ICU beds was already occupied. That same OECD report showed that Canada has just 1.97 ICU beds for every 100,000 people. Long wait times for healthcare services and hallway healthcare, these have real consequences for patients. Long wait times can cause conditions to deteriorate and even become inoperable. Patients who can't get timely care not only suffer because they have to spend time waiting and in pain, but they also have worse medical outcomes, and some even die waiting for a medical procedure. When governments ration healthcare and leave patients on waiting lists beyond medically accepted wait times, and then make it illegal for patients to choose to find an alternative way of seeking healthcare, that's not only immoral, it's also unconstitutional. The law in Canada prevents patients from accessing healthcare in a really crucial way: by paying for it, either directly or indirectly through private insurance. In Canada, we have something called the Canada Health Act. This law establishes the framework for federal financial contributions to provincial and territorial health insurance programs. Those programs are commonly called Medicare. To receive federal funding, the provinces and territories must comply with the terms of the Canada Health Act, which establishes the principle of universal single-payer healthcare. Provincial governments have responded to the Canada Health Act and their reliance on federal transfers by enacting their own legislation to crush any perceived threat. For example, the British Columbia government enacted the Medicare Protection Act, which created blanket prohibitions against private pay insurance and dual practice. That's when physicians work in both the public and private systems. This law goes beyond the goal of universal care. The law actively prevents patients who have not been adequately treated by the public government system from obtaining treatment they need outside of that system. Right now, it's effectively illegal for most Canadians to purchase health insurance or services for themselves or their families when the public system makes them wait too long. The ability of patients to choose how to access and pay for their own healthcare is something people around the world have. Canada is the only developed country in the world with this legal prohibition. The result of these laws is a system of government monopoly rationed healthcare that leaves a system ripe for overwhelm and leaves patients suffering on worsening wait lists. Forcing patients to languish on wait lists past medically acceptable wait times in the name of government monopoly ideology is wrong, and it's a violation of patients' charter-protected right to security of person. But instead of seeking to innovate during a time of crisis, governments in Canada continue to fight healthcare choice for patients in court to defend a failing system. In British Columbia, private surgical clinics, including the Cambie Clinic, which has been in operation for more than 20 years, have challenged the system, alleging that the BC Medicare Protection Act violates patients' charter rights by prohibiting them from seeking medical care outside of the government system when the government system fails. That court challenge began in 2009, so quite a long time ago, and the trial itself took more than 4 years. The trial decision was released in 2020, and the appeal was heard exactly 1 year ago in June of 2021. Now, the clinics in British Columbia have been continuing to operate because they obtained an injunction. So they have been permitted to continue to treat patients that the public system can't accommodate within maximum wait times. What's crazy is that in the meantime, BC Health Minister Adrian Dix proudly touted this strategy he had of tapping the private clinics to clear surgical backlogs that had resulted from pandemic-induced cancellations. It's a really ironic strategy of pretty much rank opportunism, since these are the same clinics that this government, the BC government, is trying to shut down. A decision in this BC healthcare choice case should be expected really soon, since, as I said, it's been now just about a little bit over a year since the appeal was heard at the BC Court of Appeal. The outcome could have a really monumental impact on improving Canadian healthcare and the perpetual gridlock, wait times, and overwhelm that patients in Canada have sadly become accustomed to. I'll say that aside from the legal fight for healthcare choice, there is also hope on the horizon for shifts in policy because of public opinion. Polls show that a consistent, if small, majority of Canadians believe that we should have the right to purchase private healthcare if we can't receive timely care or treatment in the public system. There's good reason to believe that the level of public support is going to continue to increase, and that openness to private options within a universal healthcare system, we want to continue to maintain a universal government system. We do think that that public support is going to grow and increase, especially since we know pandemic-related cancellations are going to cause wait times to get worse, backlogs to increase, if there is no alternative type of thinking or challenge to the current ideology. You can learn more about this case by visiting yourhealthcan'twait.ca, and you can also sign up there to receive regular updates, including an immediate update once that decision is released. You can also sign up for our regular mailing updates, our freedom updates at the ccf.ca/freedom updates. That way you'll stay up to date not only about this case, but about all of our other ongoing cases, like our challenge to the federal government's use of the Emergencies Act, our work on free expression, our work on vaccine mandates, and our work on property rights issues. Okay, that's all for this update. I hope you learned something today about healthcare choice in Canada and what we at the Canadian Constitution Foundation are doing to improve that situation. Thanks for watching, and let's keep fighting for freedom in Canada.